Next one is OCD. OCD is obsessive compulsive related disorder. So OCD includes only OCD? No. ICD-11, according to ICD-11, OCD obsessive related disorders are very much more in number. What are they? It includes obsessive compulsive disorder, olfactory reference syndrome, body dysmorphic disorder, body focused repetitive behavior disease, hoarding disease, hypochondriasis. I will repeat once again: OCD, olfactory reference syndrome, body dysmorphic disorder, body focused repetitive behavior disease, hoarding disease, hypochondriasis. These are the diseases. We will specifically discuss here regarding obsession and compulsive disorder and partly about the other features like olfactory reference syndrome, body dysmorphic disorder, body focused repetitive behavior disease, hoarding disease and hypochondriasis. But specifically OCD is a short note, so I will discuss more about OCD. What is OCD? OCD is the repetitive, recurrent, reclusive, impulsive thought, one's own thought. It is anxiety provoking, distressful, and this is ego dystonic. The patient will have no pleasure in that. Whereas compulsive is the mental or a physical act due to repetitive thought. That is an anxiety relieving process. It is an anxiety relieving act. So how can I say this an example? The patient will have a repetitive thought of contamination in hand. That is fear. That fear is obsession. Due to that fear, the patient if frequently washes his hand. That is compulsion. Obsession and compulsion. This is the difference. Make it clear. This is most commonly related to the female, 9 to 12-year-old adolescent female. But some books says there is no gender predisposition. Male and female are equal. So better put it as male is equal to female incidence regarding obsession and compulsive disorder. Okay. Next one is it is your some difference between obsession and compulsive disorder. Basically, anxiety provoking is your obsession, anxiety relieving is your compulsion. Ego dystonic is your obsession, ego syntonic is your compulsion. Thought is obsession, act is compulsion. Okay. So it can be remembered, obsession can be remembered with the mnemonic I murder. I for intrusive, M for mind based, U for unwanted, R for resistant, D for distressing, E for ego dystonic and R for recurrent. I for intrusive, M for mind based, U for unwanted and R for resistant, D for distressing and E for ego dystonic and R for recurrent. So as said, so the symptoms will be present for everybody at one particular time of the life. If one time it is present means also we can diagnose it as a OCD. No, you should check for the symptoms. This intrusive, unwanted, mind based, recurrent, resistant, distressing, and ego dystonic and recurrent thought of this obsession and compulsion should be more than 2 weeks. If it is more than 2 weeks, then you will say this as an OCD. Otherwise, not. Okay, that's all. So it is more commonly less than age of 20 years, most predisposedly present at the age of 9 to 12 years. Okay, how will you diagnose this case? Basically, it is diagnosed based upon the clinical points, clinical features only. Based upon the symptoms, based upon the history that is provided by the caretaker and the guardian, and based upon the history that is provided by the patient, we will diagnose this as an OCD. And based upon the duration also, you will diagnose it as an OCD. If it is more than 2 weeks only, you will say it is an OCD. Otherwise, not. That is important. Management of OCD. How will you manage the case of an OCD? 2. As usual, pharmacological and psychiatrical. The pharmacological management include your SSRIs. There is a fluoxetine, duloxetine, paroxetine, in which more commonly used is your fluoxetine. And you can use tricyclic antidepressant, that is your clomipramine, imipramine, trimipramine. All those things are TCAs. But only TCA that is used here is clomipramine. Why? Because it is more serotonergic drug. So the serotonergic drug, it is said that serotonergic drug, this is your clomipramine is very useful in the case of OCD. So it is very much preferred amongst the TCAs. That is important. Sometimes you can use augmented therapy where you will combine with uh, clonazepam along with your risperidone or aripiprazole. That is your antidepressant combination. Really. Sometimes you can give buspirone. Buspirone is a drug which is used in the smoking cessations. That is also important. You need to remember. There are some surgical interventions. Before that, you need to go about with psychiatric management. What are the psychiatric management that is related with the OCD? Cognitive behavioral therapy, exposure and re-exposure prevention therapy, or all those that are related with the OCD. And what are the surgical interventions that is done in the OCD? Whenever there is a resistant OCD only, we will do this surgeries. What are the surgeries? Deep brain stimulation, limbic leucotomy, or the surgeries that is used. Limbic leucotomy and the deep brain stimulations are the surgery that is used. That's all. Some other OCDs are related. I will say what is that? That is enough. What is olfactory reference syndrome? Olfactory reference syndrome is the syndrome where the with respect to smell, they will relate with some. They will have a persistent smelling and get some pleasure with it. Example: some will have pleasure in smelling kerosene and paint, all those things. Body dysmorphic disorder. This one, where the patient will feel worried about their shape, color, and other issues in the body. Their own body itself, they will give some uncomfortableness. If it is that, it is more for 6 months. That is called as body dysmorphic disorder. What is hypochondriasis? As usual, the patient will feel that they will have some disease. That is your hypochondriasis. It is again comes under anxiety. It is also comes under delusion. Hypochondriasis is called as medical student syndrome, and it is worried about 6 months, more than 6 months. That is also important. OCD is diagnosed if it is more than 2 weeks. 2 weeks. That is important. Symptoms more than 2 weeks, you will suggest that the patient is having OCD. That is important. You need to remember that. Okay. Depression also 2 weeks. OCD also 2 weeks. Schizophrenia is more than 1 month. That is important. So before summary, try to subscribe our channel so that it is helpful for all. And what is OCD? Obsession compulsive disorder. Based on the ICD-11, it has been subdivided into several groups: OCD, olfactory reference syndrome, body dysmorphic syndrome, hypochondriasis, and all those stuffs differ depending upon various syndromes that has been related together according to DSM, according to ICD-11 classification. Now, what is OCD? Obsession and compulsion. Obsession. It is the repetitive it is a repetitive, recurrent, resistant thought, that is intrusive thought that is coming. That is called as obsession. What is compulsion? It is a physical act that is due to repetitive thought that is coming. Ego syntonic is compulsion. Ego dystonic is obsession. Act is compulsion. Thought is obsession. And it is resistant. It can be remembered. Anxiety can be remembered with a mnemonic I model. Intrusive, mind-based, and you for what? I forgot it. Suddenly I forgot it once again. U is for unwanted, R is for resistant, D is for distressing, E is for ego dystonic, and R is for recurrent. So this is your overall I model that is remembered, that you should remember this. Basically, epidemiology, it is age less than 20 years, and male-female predisposition is equal. To diagnose OCD, it is more than 2 weeks. All other OCDs are more than 6 months. And management of OCD is pharmacological, psychological, and surgery. Pharmacological SSRIs can be given fluoxetine, and TCAs, preferable TCAs, clomipramine, which is more serotonergic, and sometimes you can give this augmentation therapy, that is, you can combine with antidepressants, risperidone, aripiprazole, along with low dose clozapine, and buspirone can also be tried. Psychological therapy includes cognitive behavioral therapy, exposure and re-exposure therapy. This is the best therapy that is provided in the OCD. And surgical intervention, which is when there is a resistant OCD is present, you may go with surgical interventions, that is deep brain stimulation and limbic leucotomy can be tried. This is an overall view. Thank you.